Menopause Access Good News broadcast, speaking to Dr. Cindy Basinski. Hi, Doctor. How are you?
I'm great. Thanks for having me on your program.
Well, I'm looking forward to speaking with you. You're an obstetrician and a gynecologist, and in Newburgh, Indiana.
That is correct.
At the
On the Ohio River.
Ohio River. That's in the University Medical School of Medicine?
No, it is not, actually.
What's IM?
It is a, it's kind of a major area in southern Indiana, northern Kentucky, southern Illinois, so kind of a hub for that area.
Aha, but you graduated from, is that Indiana University, IN?
I graduated undergraduate Purdue, Indiana, for my medical school, and also did my training up in Indianapolis at a hospital called Methodist Hospital.
Aha, okay. Surprise, it says. You're over 40 and pregnant. Current information for women as they may confront life-changing consequences of pregnancy in later years. Oh, okay. So this is an important one to know about. So and especially with all the baby boomers out there, I guess this is a little earlier than a baby boomer, not much, but I guess, I don't know what.
Well, you know, in my practice, I see a lot of women in this age group because they begin to have a lot more medical questions and issues than, say, a younger patient. When you're over 40 and you're thinking about birth control, most women who reach 40 and are in a committed relationship, they usually have already had their children, and they're really not wanting to think about any more children in their lives and move on to the next phase. And however, unfortunately, about 51% of women, or 51% of pregnancies in women 40 years and older tend to be OOPS pregnancies. And
what kind of pregnancies?
OOPS pregnancies.
Oops, okay, all right. Oops, okay.
I wasn't planning on it, but wow, it happened. And while they are generally happy about it, it wasn't something that they really wanted to do again.
Okay.
And then if you think about that, and half of those pregnancies actually happened while a woman was taking some type of birth control method. So a birth control pill, or maybe using even timing methods, natural family planning, other kinds of contraceptive methods to prevent pregnancy. You know, they often will have an unintended pregnancy. So when I see a woman in her 40s who is continuing to use birth control pills, who does not want to have children anymore because she's done with that phase of her life, I really do want to encourage them to think about more permanent options. And, you know, some of the options that have been used in the past are vasectomies and also tubal ligations that are done in the operating room. But there's actually a new procedure that came out about 5 years ago. It's called Essure, Essure, and it's also another permanent birth control method. So I really want to try to counsel these women about thinking about what they're going to do about their birth control, either on a permanent basis or a more reliable method, especially if they say, I am done, I really don't want to have any more kids.
Okay, so what would you ask, what would we talk about then? What would you say to them?
Well, you know, one thing I talk to women about, I mean, it is really a hassle to take a pill every day. And I did that for many years of my life, and am glad that I don't have to do that anymore, since we chose a permanent method, my husband and I. But many women are the same way, but they're often scared to have something else done because they think it'll be painful or risky or entail a lot of time off from work. And the fact of the matter is it's really not true. And the other issue is lots of men are really reluctant to go get vasectomies because they just can't imagine doing that. So I see a lot of women who say, well, I'd like my husband to go get a vasectomy, but he really doesn't want to do that. So then that's when I kind of bring up the discussion about Essure. And I started doing this procedure about 2 years ago, and in that time, we have done well over 250 sterilization procedures right in my office with no anesthesia. There's no incisions. It takes 5 minutes to do. Usually, once you place a device in about 5 minutes, you go home and you go on about your day. There's no disruption. You don't have to miss work. You don't have to stop exercising. And most women don't even know that they have these tiny little coil inserts that go right into the fallopian tube, which is the tube that carries the egg and the sperm where they meet together. So basically this device blocks the tube so that the egg and the sperm cannot meet. And the egg will just simply get reabsorbed by the body, and the sperm will also die and get reabsorbed by the body. So it's a pretty neat little way to think about it. And I also like to tell women in their 40s to think about, what kind of risks they're taking when they do use the birth control pills. I mean, gosh, no matter what option you choose, there's always going to be consequences or risks to those, including birth control pills, which could result in an unintended pregnancy because you forgot to take the pill, you're busy, you're running your kids around, or increased risk for stroke or blood clots. And if women particularly have diabetes, heart disease, or have had a history of stroke, I really don't want them being on birth control pills, and they have to choose an option that is more effective for them and not going to cause them to increase their risk for a stroke or blood clot.
Okay, I'm looking at your website, and Essure, is that the what you had talked about?
That's exactly right. There's icons on my website for Essure if there are women who are interested in more permanent birth control. And I think it's a big decision for women. It's not something that they take lightly, and I understand that because you understand the permanency of that kind of a decision. And so really women seeking an Essure or a husband thinking about vasectomy, we have to think these are permanent procedures, non-reversible, and I say never ever going to have a baby again. And the patients that come in, they pretty much shake their head, yes, that's right, I don't want any more babies. And they have been thrilled with the procedure. In fact, I ran into a patient that we did about 2 weeks ago here in the office, and she works down the surgery center here. And she stopped me yesterday and she said, Dr. Basinski, I just want to tell you that was the easiest thing I have ever had done. She goes, it was so simple I couldn't even believe how easy it was. But that is a response I get a lot from patients that we have performed the procedure on. So it's a good choice if you're ready to make a permanent decision. It's a good choice if you know you definitely don't want to have children. And the failure rate is extremely small. It's the only device in clinical trials that had a 0 failure rate. That's pretty impressive. So, and the success rate for a typical user, we quote 99.8%. Vasectomy somewhere in the range of 99.6% effective. Birth control pills, by the way, are somewhere in the vicinity of probably 93 to 95% effective. So you're really gaining a lot of protection.
Well, let me ask a couple questions about this Essure. And it's what you mentioned that it's a quick procedure. And what actually is this made of that goes inside of a woman?
It's actually a titanium nickel blend. And the insert is quite small. When I actually have a coil in my office that I show patients who are contemplating this decision. But for the listeners who may not have access to what the coil looks like, if you think of the little coil at the end of a pen, it kind of that is inside your pen, it's actually a little bit smaller than that, thinner than that, but it has a similar appearance. So it's just a little spiral coil, and it's made out of a titanium nickel blend. I also like to reassure patients about, they get worried about, is a metal in your body going to cause problems? And the truth is that these metals that are used in this coil are very similar to the metals that are used in other procedures like hip replacements or knee replacements or cardiac stents, that we have decades of history to look back on to say, yes, they are safe to stay in the body for long term. And again, most women are never even going to know they're there unless they get an x-ray of their abdomen, and the radiologist will see 2 tiny little coils, just like if you had staples with surgery, we'd see those on an x-ray, or if you ever had any other kind of metal placed in your body, we'd see those on x-ray. So they're little tiny coils made out of titanium and nickel, and it's a very innovative procedure that I am so excited for women to learn about, because once they learn about it, it opens up options for them that are less scary than going to the operating room and having an incision on your belly and going to sleep, which is a traditional tubal ligation.
So I see here, it was founded in 92. I'm looking at their website right now.
Oh, Essure,
2002, the Food and Drug Administration granted approval for the market. Correct. Okay.
And it's the only hysteroscopic sterilization procedure on the market. When I say hysteroscopic, What that means is we take a very, very tiny little TV camera, it's thinner than a pencil, and we go right through the center of the cervix. And the cervix is a natural opening. That's where women deliver their babies. That's what dilates whenever you have a baby. And it's usually already open enough that we can slip the camera in. And all you do is you take that little tiny TV camera and you look for the openings to the fallopian tube and you slip the coils in. Again, in about 5 minutes' time.
The market were over 700,000 tubal ligations, is that right?
Tubal ligations.
Tubal ligations.
And in America.
So what is that? That's tying the two. What is that? What actually is that?
That's a very good question, because a lot of people do not understand the difference between all of these sterilization procedures. So let's talk about before Essure came on the market. What were the choices for women? For women, permanent birth control could only be achieved by either having a hysterectomy or having a tubal ligation, both of which meant you had to go to the operating room. You would go to sleep under general anesthesia. You would have an incision on your abdomen, and they would go in and destroy a mid-portion of the tube somehow. But gosh, you're around intestines, you're around bladder, there's risk of injury to blood vessels, and it is a very risky surgery to think about going in an abdomen to destroy a mid-portion of the tube.
Okay.
With Essure, the difference is there are no incisions. You don't have to go to sleep. It's a very comfortable, easy procedure to be done and can be easily done in the office. And recovery is essentially the minute you walk out of the door, you are able to function and go on with your day. And again, the risks with this procedure are so minimal because we are not in the same area as the intestines or the bladder or major blood vessels are. So you're really avoiding all the major risks that come along with a traditional tubal ligation by looking at a hysteroscopic or a procedure like that.
And of course you can do this at any, I mean, if you have, say, 3 children by the time you're 30 and you feel that that's it for you at that moment in your life, you can do this then, right?
Oh, yes. And every person that walks through your door is a unique person. And so I've got 32-year-olds, 33-year-old women who've had 3 children, they're married, they're ready to be done. And of course you want to make sure that they're making a good decision and that they're they're not going through a divorce or something else that could change their lives. But oh yes, I would consider it in younger women who are done with childbearing.
Interesting.
So a simple, easy option for them, and it has, and speaking personally, freedom to not have to worry about getting pregnant changes your life so dramatically. I don't think people can appreciate that ease of mind. I had LASIK surgery before, and I said that was a very life-changing event for me. And then not having to worry about pregnancy was another life-changing event for me too. So these are all really not just quality of life issue. Real quality of life issues actually, because this is improving a lot of women's lives. They don't have to worry about their pills or did they take it, getting pregnant when they don't want to.
I was going to put up a quote, but I didn't put it up in the end. But this was from another obstetrician up in Boston that said that any couple who's having a normal sex life, the odds are that they're going to get pregnant.
That is exactly right.
That was her quote. Literally, that was her quote.
Yeah. Well, obviously, if they're not using any protection of all,
right.
Especially if you're using a family planning method, in your 40s, if you're using a natural family planning, it can be really unreliable because as you get into your 40s, ovulation tends to not be as predictable as when you're younger. So when you're younger, you can time those cycles a little bit better and be more predictive of when you're going to ovulate. When you're in your 40s, that can change. And I tell women, I said, your ovaries become like old cars. Sometimes you push on the gas pedal and nothing happens, and sometimes you push on the gas pedal and you overflood the engine.
Right.
And because of that, you have very unpredictable ovulatory events. Therefore, it's really hard to know what days to avoid, and you can really end up with an unintended pregnancy if you're using natural family planning.
Very Very interesting. Very interesting. Very important also in the worldwide picture.
Absolutely.
And the big picture of the world, where there's overpopulation and parents with children, 5, 6, 7. I mean, it is a personal choice, but unfortunately, in certain situations, those children aren't making it. I mean, because of realities of food and water and things like that.
And I think, and when I think about this technology that has been developed, I look at third world countries and think that this may be something that could impact them so greatly because there is no operation, because there's so minimal risk. I mean, you go to a third world country, you're not going to have an operating room suite available to you. But golly, I could do this procedure in any office anywhere in the world as long as I have my scope and my camera and a device with me. And patients can have peace of mind, and we can combat some of the economic issues that face women in other parts of the world, not necessarily America, but America too. I mean, all women and families struggle when they have mouths that they have to feed that they didn't intend on having to feed, or send to college, or whatever it is that families need to do for their children.
Sure. Well, this is a very important issue to us here. Actually, we have a show called Good News Africa, and we're very worldly, and we do World Water International Decade for the United Nations, and very involved with the world's picture, especially third world countries are my company. And so
one thing I've really looked into is what opportunities can we obtain to spread this to areas that really need options for birth control too. And even in America, we've got so many areas, especially inner city areas, where health care can be difficult to obtain. And how do we get these technologies into the hands of people who can provide that for patients who really don't want to have any more children, but they can't afford to have a surgery, or they don't have access to a doctor who can perform a surgery for them. And they can't miss work, and they can't be away from their job because every day matters to them in feeding their families and paying their rent.
I'm going to get back to you. We're going to figure out maybe do some videos and things like that. Let's discuss that.
I would love that.
Okay?
Paul, thank you so much.
Thank you, Doctor.
I enjoyed talking to you, and have a great day.
Okay, you as well. Bye-bye.
Okay, bye-bye.